How much radiation is in a PET scan, and is it dangerous? Imagine getting a detailed map of your body's inner workings with just one scan. That's what a positron emission tomography scan, or PET scan, can do. But you might wonder, how much radiation does it involve, and is it safe? Let's explore that together. A typical PET scan combined with a computed tomography scan, called a PET CT scan, exposes you to about 8 to 30 millisieverts of radiation. To put that into perspective, the average whole-body PET CT scan usually delivers around 14 to 18 millisieverts. The PET part involves injecting a small amount of a radioactive substance called 18 degrees Fahrenheit fluoro-2-deoxydiglucose, or FDG for short. This radioactive tracer adds roughly 7 to 8 millisieverts of radiation. The CT scan, which creates detailed images of your internal structures, can add anywhere from a few millisieverts up to 25 millisieverts depending on the area being scanned and the purpose of the test. So, how does this compare to everyday life? Well, natural background radiation from the environment gives off about 2 to 3 millisieverts each year. That means a PET CT scan is roughly equivalent to several years of natural exposure. While that might sound high, it's important to remember that the doses are carefully controlled and optimized for safety. Most people who have a single PET scan don't face immediate health risks from the radiation. The dose is considered moderate and unlikely to cause harm. Still, doctors aim to keep the number of scans as low as possible, especially for patients who need multiple tests during their treatment. They do this by adjusting the amount of radioactive tracer used, optimizing scan protocols, and encouraging patients to stay well hydrated. Hydration helps your body clear the tracer faster, reducing overall radiation exposure. There is a tiny chance that repeated exposure to radiation could increase the risk of developing cancer later in life. However, this risk is very small and is far outweighed by the benefits of accurate diagnosis and effective treatment planning. Children and pregnant women are more sensitive to radiation, so extra precautions are taken with them. In the end, the amount of radiation from a PET scan is moderate and well managed. It's a powerful tool that helps doctors see inside your body clearly, guiding treatment decisions and improving outcomes. The small radiation risk is generally outweighed by the benefits of getting the right diagnosis and care.